Well, Happy New Year, Australia, for we are one and free. Our anthem is about us, who we are, and who we hope to be as well. We're a strong and vibrant liberal democracy. We live in a timeless land of ancient First Nations peoples, and we draw together the stories of more than 300 national ancestries and language groups. How good is Australia? And our anthem should reflect that, and the changes that we have made and we have announced today, I think, achieve that goal. It simply reflects the realities of how we understand our country and who we will always hope to be, and the values that we will always live by. It's a straightforward proclamation by the Governor-General that he signed off on the day before yesterday, and followed the same process as was undertaken back in 1984 when the change was made by Prime Minister Hawke. It's a change for all Australians, and I've already been encouraged by the strong response from Australians right across the country, Indigenous, non-Indigenous, people of all different backgrounds, people of all different political views, and I think this very much sits in the mainstream of where Australia would like us to go, and I think it's a great way to start the new year. But of course the new year does not start without its challenges. COVID still hasn't gone away, it hasn't taken a holiday, it won't be going anywhere. And as a result, we continue to deal with the very serious challenges, and that's why I'm pleased to be joined today by the Chief Medical Officer, Paul Kelly. I want to congratulate Australians for doing the right thing last night, and not just last night, but over a longer period of time, particularly in Sydney and Greater Sydney and the Central Coast, and now including down in Wollongong, as New South Wales has done extraordinarily well to get on top of this latest outbreak. Today's news is encouraging. The news in both New South Wales and also in Victoria. And I will ask the Chief Medical Officer to speak more to those points of information that have come through, particularly in the last 24 hours. I want to thank people, particularly in New South Wales, but also increasingly will be the case in Victoria, for their response to the public health messaging and the controls that have been put in place, especially coming forward for testing. I mean, the record numbers we've seen come forward for testing has been extraordinary and enormously helpful for those who are doing the job to keep Australians safe, both in those areas as well as for the benefit of the other parts of the country. And in Victoria, we are seeing already, I think, the results of the strengthening of their tracing systems that have been put in place over many months, and it's been good to see how that swung into gear over the course of the last 24 hours or so, or longer, and we're seeing them getting on top of that information very quickly, which is assisting them in managing this most recent outbreak in Victoria. I also want to just note that the wastewater testing results that the Premier of New South Wales referred to in her own media conference just recently, which revealed that the areas where we know there to be cases have been confirmed in that wastewater testing, but elsewhere across New South Wales, outside the Greater Sydney area, with the exception obviously of Wollongong where that was confirmed, that remains low and negligible risk, and the Chief Medical Officer can speak more to those issues. The Aged Care Response Centre is activated in New South Wales and continues their work in Victoria. Asymptomatic testing has already been underway in New South Wales for some time, and it's being expanded in a number of other areas as we speak, and that has been reinforced both by the Aged Care Commission, Quality Commission, and the work done by the department in reinforcing messaging around infection control and use of PPE. We have no active cases in aged care across the entire country, including in New South Wales and in Victoria. There has been some primary contact exposure in 5 cases we know of in Victoria, but 3 of those have proven to have no positive impact from those contacts, and we're waiting on 2 others, but the news there is pretty encouraging. Just finally, before I hand over to the Chief Medical Officer, since the 18th of September, as we've now drawn to the close of last year, the figures on December 30 was that 63,109 Australians we were able to get home by the end of the year since the 18th of September. Now, as you know, that's more than double the number that we had as our target of just around 26,000 back in September. Obviously, more people have put themselves on the list, and there are still quite a number on there at a similar level that we've talked about in recent times. Australians want to come home. We're going to keep helping them come home. Those flights are continuing to come to Australia. The expanded quarantine and support in places like the Northern Territory and others are doing their job as those flights continue to come through, and that'll continue to be an issue we manage into the new year. But our process here as a federal government continues. The AHPPC, the medical expert panel, continues to meet every day. I'm remaining here in Canberra for the foreseeable future over the course of the next week. If there are any changes to the arrangements with the ACT, then that may enable me to get back to Sydney next week, but I think that's unlikely. So I'll continue to work out of here over the course of the next week. We're taking regular health briefings in particular, as well as meeting with Defence Force and the National Coordinating Mechanism out of the Department of Home Affairs to stay on top of the many requests or other issues that we're dealing with to support the states and may otherwise be required. At the end of next week, from that following weekend, I'll be taking 1 week's leave. The acting Prime Minister will be the Deputy Prime Minister, Mr McCormack, and he will continue in that role for the course of that week. So with that, I'll pass you over to the Chief Medical Officer, Paul.
Thank you, PM. So, as the PM has said, we're meeting every day. The AHPPC, which is, I think everyone knows who's on that now, but all of the Chief Health Officers from all of the states, we get updates at that meeting from all the states, but particularly New South Wales over the last few weeks, and now Victoria. And that group of experts that's got us through that very long year of 2020, and with advice to the National Cabinet and to their own governments, continue to give that advice, to offer assistance and so forth to particularly New South Wales and Victoria at this time. I'm very encouraged by what's happened in New South Wales over the last couple of weeks, and that news today that there is a definite genomic link between all of those clusters that they've seen in Wollongong, in Croydon, and in the Northern Beaches, as well as other parts of Sydney. So that demonstrates a couple of things. I think the PM's already mentioned the wastewater testing as a guide to where issues may be occurring, and that at the moment is only in the Greater Sydney area and Wollongong, including the Central Coast. But that's being regularly looked at and interpreted by the public health authorities. And the genomics testing, which this time last year we did not have that ability to be able to so quickly link in the laboratory, as well as the epidemiological investigations, what is actually happening, and to guide that public health response. So that test, trace and isolate part that we've talked about so often is really excelling in New South Wales and again in Victoria. So in the last 24 hours, the linkages they've made between the various cases, and they are all linked, where they've been is guiding the approach now. That's linked into, as the PM has said, about our approach and response in relation to aged care facilities. No cases there in staff or in residents at the moment, but a very precautionary approach using all those learnings that we've learnt through the long year of 2020. So just to stress that, it's really important, particularly in Greater Sydney area, but throughout New South Wales, and the same in Victoria, and indeed all around the country. If you have even the mildest symptoms of this disease, and we all know what that is now, get tested. And we've seen an enormous response in Sydney over recent times. I'm sure the same will happen in Melbourne with these recent cases. But just to give a real call out to the Northern Beaches, in the week up to the 21st of December, 432 per 1,000 of that population were tested. That's 43% of the population of the northern part of the Northern Beaches were tested in that week. That's the sort of response we need whenever we see either the wastewater testing becoming positive or a case being found in an area. So I think we need to remember that whilst there are active cases in the community in both Victoria and New South Wales at the moment, in Sydney and in Melbourne, I should say, and in Gippsland, it's only 11 cases yesterday confirmed in Australia. There were over 50,000 cases confirmed in the UK yesterday. And when we think about our experience here in Australia through 2020, although it's been so difficult, it is so different from the rest of the world, and that's a real, we should really remember how well we have done as a nation, but also, with the public health response and also the political commitment to really tackle this disease head on, and we've done a great job. 2021, of course, will add an extra tool to our toolkit in terms of approaching this, in terms of the vaccine, and that's coming soon. And we continue to work through this holiday period on all elements, including the implementation of our rollout plans, as well as the regulatory response to make sure that we have a safe and effective vaccine for Australians, all Australians who want to get that vaccine throughout this year. Thank you.
Prime Minister, with orders going up, people being forced into quarantine at the last minute, delays in traffic, concerns about employment prospects, can you understand that some Australians may not be feeling one and free at the moment?
I understand the frustrations that people have with the disruption that comes from those changes. We're dealing with a pandemic. That hasn't changed. But it doesn't change who we are as Australians. Australians are Australians whether they're in Queensland, New South Wales, Western Australia, Tassie, wherever they happen to be. And that's not affected by those things. These changes have been put in place by states for public health reasons, and that's their purpose. Not to divide Australia, but to, in their decisions to seek to keep Australians safe. Now, each state and territory has, over the course of the pandemic, had their own approaches from time to time, particularly when it comes to borders. I welcome particularly the approach that we've seen from Queensland most recently. They've adopted that hotspot around Greater Sydney. People know my view about, I think, the great approach that the Northern Territory has taken all throughout this crisis. They identify hotspots, they come on and off the list, and I think that has proved to be a very effective way. Tasmania, similarly on this case, continues to treat both Victoria and New South Wales on a hotspot basis. And I think that is a constructive way, and I welcome that approach. But look, at the end of the day, state governments are elected by the people of their state to exercise their responsibilities when it comes to the public health of people in their state. And as much as we would like there to be greater consistency across all of these things, we must respect their jurisdictional authority, because they're ultimately responsible for what would happen in their state if there were to be an outbreak in their state. And as Prime Minister, I do respect that. I can have whatever view I may wish to have, but ultimately they're responsible for those things, and I have to respect the authority that they've derived from their own electoral processes in making those decisions. So I can understand the frustration. We are similarly in a situation. One of the reasons my family and I remain in the ACT is because I need to be in Canberra, and if I were to go to Sydney at present, it would mean I would not be able to return here. And as a result, we're remaining here because this is where I need to be able to be with Paul and the many other advisors and others who are managing these most recent set of events. So we all are dealing with these things, and I thank Australians for their forbearance, and I think that has been one of the great qualities of Australians over the course of these last 12 months. And to pick up on what Paul just said, look at the alternative. Look at the alternative overseas. Look and see how others are spending this time in so many other countries around the world. And as frustrated as we might be from time to time, I think there's also an opportunity to count our blessings.
There's obviously been a lot of support for the change today, but there's many who say that doesn't go far enough and would like to have seen a complete rewrite. What do you say to them? Was that considered? Will that ever be considered? No,
this is a simple change, I think. It's a change that I think is very much in accord with where Australians feel about these things. It's not pretending to be anything more than it is. I think it's been well received across the country. There will be those who don't think it goes far enough, and those who think it goes too far. Well, that's democracy, and that's one of the things we celebrate in our national anthem. But I think it's a sensible change, and I think it'll be well received, and I look forward to it being sung the first time. Perhaps that will be at the SCG test. in a few days' time. I was actually texting back and forward this morning with Justin Langer and Tim Payne and wishing them well for the test, and because normally they would be at Kirribilli today, and none of us are going to be at Kirribilli today. But they assure me they're going to bounce back, and I have every confidence that they will.
Prime Minister, any chance you wanted to be the first to sing the new national anthem? You are alongside Paul Kelly.
Well, I think singing by Prime Ministers is the same as with public exercise by Prime Ministers. It's best done in private. I'll leave the singing to Tina Arena and others who are far better at that than me.
It's our national anthem, though.
Yeah, you'll hear me sing it in a crowd, as always.
Prime Minister, back in July you said that Australia couldn't afford to go stop, go when it comes to these border restrictions. Isn't that essentially now what we're facing heading into 2021, that states are not going to be able to open up forever if they continue to see these small clusters?
Well, we are moving towards a vaccine into the new year, and that, I think, will obviously change the parameters for everybody, but that will take some time as we move through its distribution across the community. And this is why, when I see what some states have done and looking at Greater Sydney as a particular area of concern and managing that way, then that's welcome. But I think we have to keep reminding ourselves there is no just simple, easy way of this all being fixed. It's a global pandemic, and that means there will be frustrations from time to time. They're disruptive, and they can put long-held plans at bay, and that can be very disappointing. But we will continue to get through it, and I think it's important that when states are making these decisions, they must give thought to balancing the risk of COVID and its transmission against the disruption to people, and that's what they are accountable for, and that's what they have to explain to their citizens in their own states.
Just following from Judy's question, obviously you're saying it's going to take some months, but once we start a vaccine rollout, will you want to reboot the roadmap to reopening timeline and process? Is that the point and would you expect the Premiers to stick to it?
Well, the roadmap doesn't change. I mean, the roadmap always has as its goal to get all of these things lifted, and I would hope that as quickly as states have moved to put things in place, that they would move as quickly once that risk subsides. And we saw that in most cases after the Adelaide outbreak, which was able to be get on top of very quickly. We've seen borders on this occasion come up more promptly than it occurred when there was the significant Victorian outbreak, and the New South Wales border was not closed for some time until after that was done. So, this is why I sort of hold out the Northern Territory as a very good model. They declare a hotspot, and it goes on, and then it comes off. And I think that that is a very good model, and that has been my consistent view over these many, many months of the pandemic. So I think this gentleman...
You mentioned the disruption, Prime Minister. Does the latest round of this, we've seen queues at borders and quite a lot of confusion. Does it create impetus to rethink the timeline to bring in a vaccine and the speed with which that's rolled out?
Public health is our number one priority on the vaccine, and there'll be no shortcuts. The standards must be maintained and upheld, and that's what Australians expect. For the vaccine to be successful, Australians have to have confidence in it, and I believe they will have confidence in it. I was discussing this with Professor Skerritt this morning on our regular briefing call today, together with Paul, and he may wish to make a point about this as well. There has been, in no other advanced jurisdiction, an approval given for the AZ vaccine. There have been emergency authorisations given, but this isn't countries like in the UK where there's hundreds of people dying a day. Now, Australia is not in that situation, and so we are being careful to ensure that we dot all the I's and we cross all the T's to ensure this vaccine is safe and able to be distributed across the Australian population. Now, we are moving promptly to do that, we are moving swiftly to do that, but we are not cutting corners. If there's no tick, there's no jab, and that's got to be right for every single Australian. And so our authorities are doing a tremendous job on this, but you need to get all the right data, and that needs to be validated. There's the batches that also need to be tested as well. It's not just about the initial vaccine itself, it's what is actually going to be distributed around the country. It's important that that process is also followed. So we are being meticulous about this because I think that's what Australians deserve, but I think it's also important from a public health point of view in ensuring public confidence in the way the vaccine is distributed. But Paul?
Thanks, PM. So we now have 3 vaccines that have published in the public domain their interim results of their phase 3 trials. So the third one was Moderna. It came out day before yesterday in the New England Journal. So we can be confident all of those 3, 2 are mRNA vaccines, the Pfizer, BioNTech and the Moderna, and then the AZ vaccine, which we're making here in Melbourne, and we'll have plenty of doses of that through 2021. So those 3 have shown good safety profiles and good efficacy, but that's not the only data that's looked at by regulators. So as the PM has said, there is not a single major regulator in the world that has given full approval for any vaccine at the moment. There have been particular emergency use authorisations, which in several countries, so in Europe, in the UK and the US in particular, but they are in an extremely difficult and different situation in relation to this pandemic compared with Australia. There have been now 82 million cases in the world. Here in Australia, just over 28,000. There's been 1.8 million deaths in the world. Here in Australia, 909. They're very different situations, and we need to go by the regulators. They have always been cautious, and it's kept us in good stead. And the TGA will look at all of the data, the tens of thousands of pages of data that will come from the companies, and make their decision.
Yeah. On the vaccine, you don't rush to failure. That's very dangerous for Australians. And those who sort of suggest that, I think it's a naive suggestion.
Related to the anthem, has Cabinet considered the options for the voice to Parliament, and when can we expect to hear about that? And just separately, you're the convener of National Cabinet. How come National Cabinet isn't meeting again until February 5?
Because that's its next scheduled date, and there's no need for it to meet at this present time. I mean, all the agencies are working closely together. The AHPPC is meeting every single day. I'm in regular contact, particularly most recently with the New South Wales Premier. The Victorian Premier is currently on leave, I understand. And so if there was a need to bring forward a meeting, we always could. But at this stage, there hasn't been something for the Premiers in particular to action as a result of advice that has come forward from the AHPPC when it comes to particularly handling this most recent pandemic. Their views on borders will be the same if they met this afternoon as they were a month ago. What we need to focus on right now is ensuring that the outbreak is contained, the support that is necessary to be provided to those jurisdictions that are dealing with the outbreak is in place, and that is being delivered through the ADF and other agencies. And the communications I'm having with those states, and particularly through Greg Hunt as well, who's speaking to Minister Foley also quite regularly, those systems are working well. The National Cabinet is not an operational committee. There are people like Paul and others who do that work, and they're doing it very well.
Prime Minister, earlier this week...
No, Cabinet has considered that matter, and the Minister for Indigenous Australians will be making announcements at an appropriate time.
Prime Minister, earlier this week, Professor Kelly said he wouldn't be sending his family to the SCG for this test. Should this event be going ahead with spectators, and would you be sending your family? Were you able to get back to Sydney?
Well, look, I have great confidence in the decisions that the New South Wales Government is making in relation to these matters, and I know they'll be following the medical advice. And that's how you manage these issues, and whatever level of crowd they ultimately decide is appropriate for that public event, I'm sure will be based on that health advice, and so on that basis I'm comfortable with those decisions, and if they say it can go ahead, and if I happen to be in Sydney, I think that's going to be unlikely given that I suspect where the ACT's position will be over the course of the next week. Then if I was in Sydney, I'd love to go there and sing the national anthem in its new form.
Yesterday marked the 1-year anniversary of the WHO first being informed.
I don't think the girls want to go to the cricket though, somehow. But, you know, if they want to come, they could come with me. I know Jenny doesn't want to come.
I wouldn't mind going. Yesterday marked the 1-year anniversary of the WHO first being informed by China of the new virus. Are you frustrated, or is Australia frustrated at the progress in the investigation of the origins? And do you have any regrets about the way Australia led the calls for that investigation, given the ramifications?
No, we're patient and we continue to monitor the progress of that inquiry closely and support its swift conclusion.
Prime Minister, just one for the Chief Medical Officer.
Sure.
Sorry, Professor Kelly. We're seeing some reports coming out of Victoria now. They've suspended testing in some parts because of a concern about the number of people coming back from New South Wales. Are you aware of anything to that effect? And would it be concerning, given what we saw in Victoria just a few months ago, that they would suspend testing at a time like this?
So I had extensive conversations in AHPPC about testing yesterday, including in Victoria, and I've had since then 2 conversations with the Acting Chief Health Officer, Professor Alan Cheng, just urging them. I know Minister Hunt has also been in contact with Minister Foley on that basis. So yes, I definitely urge greater testing in the coming days, particularly in those geographic areas of concern. So I'll follow that up, but I haven't heard of any particular halt. Certainly from our perspective, our GP respiratory clinics, we've expanded the testing, in fact, in those ones that are run through the Commonwealth.
Prime Minister, is there a view within government about what percentage of the population will need a COVID vaccine in order to kind of live in a COVID safe way and have no real restrictions?
Well, it's a medical question. I'll defer to the CMO.
So the vaccine will have an effect on that, but I think people need to realise it's not a magic bullet immediately. When the vaccines are found to be safe and effective, they will be rolled out in Australia, starting with those priority groups that we've talked through in many times, and based on the expert advice from the Australian Immunisation Committee. ATAGI. So that will happen as soon as it's ready to go and it's safe to do so. We'll be using it. That won't change everything else we're doing in relation to the pandemic immediately. We need to roll that out as we're planning to do through the whole community next year, and I really encourage people to come forward when that's available to get that vaccine.
Is there a ballpark though, like 95%, 90%? Is there a concern about there is a possibility people are not going to want to take it?
So as many people as possible. Every person that takes it is going to be helpful. That's one way of improving the immunity within the community and decreasing the chance of transmission of the virus. So we're aiming for as many people as possible that can get it, starting though with those high priority groups, our healthcare workers, our aged care workers, our aged people who we know are the most vulnerable.
And Australia has a very good record on vaccinations. We have one of the highest vaccination rates in the world, and one of the reasons for that is the system of regulation and authorities and approvals we put around vaccines themselves, and that's why the government is being meticulous about following that process. I think that is good for public confidence. It is something that I've discussed with the premiers and chief ministers, and they're very supportive of that because of the nature of the take-up that we would hope for. And I think following that meticulous process is a strong national position. Okay, we've probably got time for one more.
Following from Andrew's question, are you hoping that the new year will see a bit of an improvement in the Australia-China relationship? The Foreign Minister of China has reported this week as saying he wants things back on track as early as possible. Are you hoping that this new year will see a better relationship between Australia and China?
Well, I'm always optimistic. I'm always hopeful. I'm always positive. And I would certainly welcome that, and that would begin with leader level and ministerial level discussions, which we are ready and open for, and we're happy to do those. And as soon as those occur, then I think you would see that being fulfilled. But that is not an obstacle at the Australian end. Okay, thank you all very much. I wish everybody a very happy new year. Stay safe, and stronger, safer together is how we cut through 2020, and it's certainly how we will emerge even more strongly in 2021. Happy New Year, Australia.